Dr. Becky Morrow is a shelter veterinarian and professor who is very active in the animal rescue community. She founded Frankie's Friends Cat Rescue in 2010 after she cared for over 400 cats rescued from Tiger Ranch, a massive institutional hoarding facility. She's performed tens of thousands of spays and neuters and teaches high quality, high volume spay neuter techniques to other veterinarians and veterinary students. Dr. Morrow, or Dr. Becky, is often called upon to speak on topics related to community cats and TNR, and has worked with dozens of shelters and rescues in Western Pennsylvania to bring the mobile surgical unit to underserved regions. In addition to being president and medical director at Frankie's Friends, Dr. Morrow is an assistant teaching professor at Penn State University and an adjunct assistant professor at the University of Florida College of Veterinary Medicine's online shelter medicine program. Becky, welcome.
Okay, so yes, you heard a little bit of background, and I got to know some of our audience members a little bit based on what I was hearing from your questions. So I'm just gonna, I kind of ran the gamut a little bit here. I was a private practice vet for 6 years, and been teaching for a while, basic sciences, and I did a little bit of teaching at veterinary school. I'm a shelter veterinarian though for 16 years. So this is, I finally found the, I saw the light and came to the right place. So, but I balanced these roles out. I definitely did private practice, was not for me, but this world's wonderful. So yeah, I mean, the main reason we started to do this was honestly to support the cats that we took in. I bought a house for 150 cats that were still left from the cruelty case. They didn't have anywhere to go, so what would you do? Buy a house, of course. And I'm a professor, so like, we need money. So started to do the surgeries to help us to support the organization. But what we really kind of, as we went on, we wanted to focus on community cats, because there's so many cats that are not spayed and neutered in the population, and 80% of the kittens born that go into the shelters that are filling up our shelters are from this population, and we know that there's almost 1 million cats euthanized each year. So it's kind of funny, my introduction to high quality, high volume spay neuter, which I have the acronym backwards on there, I just realized, is when I was in academia, I found some other professors in the department. They actually found me right away that were really interested in, we called them feral cats back then, and we wanted to help feral cats, and we were trying to come up with a service learning project for our students. And we teach biology students, we have microbiology, physiology, and all of those things are very relevant to this population of cats. And one of my students, upper left-hand corner, Hannah, this is how I learned, and it was the same kind of clinic that Karen was talking about. But we were working out of different humane societies and other rescue shelters in the area, utilizing their facilities, but we had to bring all our own supplies. And I was watching this group and I thought, wow, how can you do 150 cats in a day on a weekend? And that was my introduction to it. So and it was a very volunteer driven, like what Karen was talking about, and volunteer vets. And eventually we were collecting samples for a research project with the cats when they were sleeping, taking that leftover blood from testing and taking some ear swabs and whatever else while they were sleeping. And that's how I got involved. But then I started to become the surgeon for the group. I didn't know I could be this fast though. So veterinarians are not given the opportunity to shine in vet school. They make everything slow and make a big hole and all of these things. So you really don't realize your potential. And I think that's one of the things that I'm trying to teach others, is that, wow, look at what you can do out of a small hole and how you can be more efficient. And this person in the front there in the, I'll call it salmon, Dr. Hughes, was how I learned that I could be better. So I refer to Dr. Hughes a lot. So my first mobile unit was actually a box trailer that I bought from Craigslist. And I say I bought, meaning using my husband's credit card for $4,600, and my dad and I ended up making it into a mobile surgery unit. I used his beat up pickup truck to drive it around. So yeah, we literally started in my backyard. Our first building I got on the upper left, got this small building in our community that was only $26,000. So I bought that with my retirement money, because why? Who's going to retire, right? So we got that. We eventually got mobile unit 2.0 for $14,000, and that was with the cabinets and everything in it. Got a building from an old chiropractor. So at this point, we're building up mobile 3.0, and it's going to be a little bit better, have some levels, side leveling jacks, and some other things that I like to have. Our truck's still going strong, so we're good to go. But this is my surgery room, basic setup. And we had 2 surgery tables, our wet sink, and everything you would need. We have since moved, and we have another building I don't have slides of, because I'm now training other vets to do this. So we set up 4 surgery tables, and we have larger prep station, larger post-op station, and so forth now. So high volume spay neuter, one of my favorite pictures. Oh, the little gingers, yay, cute little gingers. Anyway. So, you know, this is the thing. I mean, I came from a traditional private practice, and I thought I was doing a 10-minute spay and I was doing just great. That's what I thought, until I met Dr. Hughes and folks. So the other thing, you know, we didn't do in private practice was the tattoos, which, oh my goodness, this is such an important thing, guys. Ear tips are fine. I love ear tips, but they can still have we still double check to make sure they're spayed. We look for a scar. If they came in and we're giving them the rabies shot anyway, we double check. And a tattoo helps us so much. It saves us from having to open a belly unnecessarily. So at the AAFP, which is the feline practitioner conference last year, we actually tabled, and I was handing out little pamphlets on how to tattoo a cat, because this would be so great if we could just make this something that all vets did. All right, so yeah, how do we do this? I personally, my biggest day was 74 cats, and it was a 9.5-hour day, and I had 3 other people helping my team, as well as our community partner running the intake and discharge and so forth. But you know, these are the things that I've learned. I've worked with, this is from the homeless cat management team pictures. I set this clinic up. I've set up 5 stationary clinics, and I'm on my 3rd mobile right now. Set this up in a vet school. So it's the system that works, and it's transferable, and that's what's awesome. If you have a system and you can adapt it to different situations, like I think that was Dr. G was talking about that. Yeah, every situation and so forth is different, and you can adapt to it. But we've found some things over the years that work, and that's what we're trying to share. But it really comes down to teamwork. And my team is folks that are pre-vet students, because I teach I teach the basic sciences, I teach biology. I bring a lot of pre-vets in, we train them. This is one of our technicians who is LVT. She's holding a cute little cat. And of course, I stopped surgery in between to take this picture because cute little cat. But as I think Dr. G was saying that too, she'll jump in as a tech, and everybody is cross-trained. You can seamlessly move in and out of different positions, and it's due to the communication, the things that we do to communicate that we've simplified. And it's kind of like when you see somebody in a fast food industry and they're just working as a team, and it's solid, and you're like, how is this working with this well-oiled machine? That's what we've established. And we've tried it in multiple different scenarios with different people, and it holds true and it works. So this is going to be where I go back and forth some videos, and I'm going to be trying to do that without too much interruption here. There we go. I have to unmute. Show us that we're not rushing. Everybody is doing their thing. We are all, you know, playing our role here. You can see there's somebody doing post-op, putting the kitty back in the crate. I have pre-vet student there, Kelly, who's now a vet student. That was back, she's her 2nd year now. And I have Maisie on the ground, who was a student at the time at the vet tech school. Now she's one of our technicians. And Julia, who's been with us for I've known her for quite some time. She was my student years ago. She's been with us for 9-10 years since we've been doing this, and then one of our community partners. So I just want you to realize we're not rushing, we're not cutting corners, we're just working together as a team, and we are really communicating so that we can all know and be on the same page with each other. All right, so yeah, I mean, I think this is the biggest thing that's hard to do is paperwork, and we tried to switch to digital and it slowed us down so much. It was not worth it for us. So we kind of do a hybrid situation where we're billing people out. We do put some medical records in, but we are still sticking with our paper because that is how we are as efficient as we are. And it may depend, different groups might be different. I even had multiple tablets to try to use. That was not helping us out at all. So we just keep it really simple where we have pre-op medications drawn up and written down. We have our little check boxes if there's something wrong. The people at pre-op will mark it down so we can deal with that while they're there. And again, just like Karen was saying, we do everything they need. If this is a feral cat, they're coming in once in their life. If they have a couple teeth that I need to remove, I'm going to take them out. We're going to do what we need to do and get them back. If there's an eye that needs to be removed, we'll take that out. Well, if there's a tail that needs to be removed, we'll take that. We've done sutures, wounds, other things we will do before that cat goes back out. And if it is something that needs longer care, we do have we consider ourselves to be a medical rescue. That is our other part of it because we can't let these cats go back out without care. What we then have is we came up with different colored paper for medical. Sometimes we'll do medical checks for our community partners. And if it's in a white form, that means they're getting anesthesia and they're part of the spay neuter. So we don't want them to get knocked out, as we like to call it, accidentally. So we came up with that. That helps us a lot. Intake can look different depending on where we are. So if it's a mobile clinic versus it's a stationary clinic, if it's in a barn, if it's in a fire hall, we do a lot of fire halls with the mobile. We go to one person's house. She has a great setup in her garage. She's one of the very first clinics we ever did at a mobile clinic. So that's one at the barn. Love that picture. Our little mobile there set up. This was a really, really smelly one. I remember it very well because they did not have pee pads in there with the cats, and there was poop all shoved down in there. Fun stuff. Good times. Gotta love that. So this is the back of my mobile. I just set it up really simply. It's a box trailer. 18-foot was the ones before. I now have a 20-foot one because I wanted to have an extra surgery table so that I can train people. So we have ability for about 25 cats that can fit in there, and they're just in their carriers sitting there. They look pretty chill if you can see their little cute faces. Being in their carriers keeps them calm versus private practice. We used to put them in big stainless steel cages. And I can tell you they never looked as calm. So I think that's a big part of them. They smell, if the carriers smell like themselves, and even though they didn't want to get in there in the first place, it is comfortable to them compared to being put in a very sterile feeling stainless steel cage. So this is at the vet school, so same process. I just bought shelves for there, just like we had at Homeless Cat when I set that up. We always have the paperwork with the cat. Paperwork goes with the cat because we do not put any special collars on them. We do not put markings on the cats themselves, but the paper will always be with them so we know who they are. The other thing that we do is we put the medications when they're drawn up. You'll see that on there, and I'll show this picture again. This was a really simple thing that we made up because we had the one sad situation where we put 2 black cats in the wrong carriers one time, even though the papers were there, people didn't read it. It was just an error. And we figured it out, but I did not want that to ever happen again. So I came up with a really simple solution that as soon as you take that cat from the carrier, or even before that, when we do the knockout drugs, we actually assign them a colored clip. We put that on the carrier, we put one on the paperwork. So the paperwork's always going with the cat. You can match up the color with the carrier from which the kitty was taken. So this is very simple, but works great. We recycle them as the cats get put back in for recovery. We take the clips off and then use them for another cat. So you really just need like 6 or 7 colors. So here it is there. When I was at University of Illinois, I didn't have enough colors at the Walmart, so I made them polka dots. So we had polka dots and stripes on these ones, but you can see the one is indicating that the cat is out of the carrier. The blue one means that that's going to be where the cat returns. The blue clip would be on the paperwork with the cat. So that works pretty well. We drop our knockout drugs and we put that on top of each carrier. We have a modified Kitty Magic that I've been using for 20 some years, and if it's not broke, don't fix it kind of thing. We can reverse it if we want to. It gives us just enough depth of anesthesia where we top it off with about 1% isoflurane, but they also wake up nicely, calmly, no bobbling around, and we can reverse if we need to, but it's very rare that we have to. So it's really easy to calculate this dose for 10-pound cat. The Torb, dexdomitor, and ketamine, those of you in the field know these drugs. They're very commonly used, but for 10-pound cat, it's 0.1, 0.1, 0.2. We double the ketamine. For 5-pound cat, 0.05, 0.05, 0.1. And 7-pound cat, you can probably guess, 0.07, 0.07, 0.14. Now, you can draw this all up and put it in a cocktail if you want to. We just like doing it individually because when I'm training others, number one is they can do this at any clinic. You don't have to have a cocktail mixed up ahead of time. And also we figured it makes us, I guess, makes us feel better, even though we're good at what we do. If you have an error, which I've never seen that happen, but it can, it's only one cat versus the entire bottle. So that's just us. It is not the most efficient, and I will totally cop up to that. All right, so there's our drugs drawn up in the bottom left. You can see ready to go. Drugs are ready, and that's based on estimate as well. And the good thing about this protocol is that you can go almost like 3 times this dosage is within Bushby's protocol. So as long as you can tell a 5-pound from a 10-pound cat, you're so fine with this. Very nice protocol. I like this because it shows the size difference and it shows tabbies. I can't say I have favorites because I love all kitties, but I do love the tabbies. Anyway, so we get everything ready ahead of time. We use these dry decks, which are just the things you can buy for the floors and so forth. You can snap them together, you can make them different lengths, but we call them waffle mats because it was fun and somebody came up with that, one of our techs. We get that ready. It keeps them off the table. It keeps them, they can, if we have to empty the bladder, they're not sitting in the urine. If there's something that you're flushing a wound, they're not sitting in the fluid. It just nice little way to do that. Also, you can put there's one with a heating pad too. You can put a heating pad under there and you cannot burn the cat. So you can have multiple heating pads lined up with these waffle mats on top and a pee pad underneath, and you'll be safe to keep those kitties. This is a kitty that was shot with an arrow. I just did not have a good picture of one with the spay neuter. So we get everything ready ahead of time also for post-op. And you'll see we'll give our vaccines, we'll give a rabies shot, for everybody gets that. We give the penicillin shot. That's more for me, I think, than the cats, but you just don't know where these cats have come from. It makes you feel better that you gave them a little bump in the right direction if they're harboring some kind of infection. It's not to make up for not having good sterile procedures by any means. We follow all of the ASV guidelines, which are made for this purpose. So we get flea medications, everybody gets. The worm medication, we use Profender only if it's asked for because it's expensive, but that's really the only topical deworming agent, or well, any deworming agent that gets almost every single stage of every single worm that we care about. There are multiple larval stages that drugs don't get. That's why you have to dose parental pamelate, for instance, 2 weeks apart, because you can't get every single stage that life cycle. So our best drug we have is Profender, but it is costly, so we give that. If it is a cat that looks like they really, really need the help, we'll give it and we just won't charge them, or people will request it. So all of our stations are going to have a size 3 endotracheal tube, as well as epinephrine ready to go, very, very close distance, because when we do 8,000 cats a year, you are going to see cats that have underlying cardiac conditions. They will have these very, very acute cardiopulmonary arrest, and we want to be there to be able to jump in. So we actually, very, very simple protocol, 0.5 cc's epi per cat. You get a tube in, which I can do by myself and the techs can do by themselves. We get the tube in, we put that drug in the tube, blow it in, and get going with CPR. And we have over 90% resuscitation rate. So That doesn't mean they're normal, because they are going to be suffering from an underlying cardiac defect. And I can say that almost 100%. If they do not make it, or if we euthanize them because we've called the person and talked to them about neurologic effects that are going to be seen, we always do necropsies, and that's a whole nother talk. But I'm seeing a lot of right ventricular defects, and it's a type of cardiomyopathy that we underdiagnose apparently in the field. So more to come on that, hopefully. But then having a stethoscope ready is very important. But we do palpate a lot with our hands. I can do a lot just by feeling that cat's chest. I can feel the heart rate, I can feel the rhythm, and I can feel the contractility, how hard the heart is squeezing. So that works really well too. All right, so here's my next video. This is Julia with her very, very bright red hair. And we are going to look at our basic knockout. Is going to be very simple. This is a friendly cat. All right, so she's gonna look and see the cat. Yep, that's the right cat. We got the drugs already drawn up. We're gonna go intramuscularly, and she's just gonna give it in the front arm because that's less stress for the cat. All done, close the thing, and she's gonna be like, what? That was no big deal. I like when she shrugs like that. Alternatively, everybody has their way of doing it, so it depends on the tech. Here's another one. I'm gonna show you with a trap cat. And we try not to use the separator, aka fork. Most of these cats will just sit still when you get, and I've learned I'm much better at this now too. I used to try to go really fast and just get it in it. And going slowly and just going very, very slowly with a 25 gauge needle, most of them will sit still. I mean, our team is very good at this, of course, but I teach my pre-vets how to do this, and they get good at it pretty quickly. So we do use a glove and push back with the cat if they're in a carrier and we're worried about safety issues, but most of the time they do quite well. And we do, for mobile, we were doing 50 to 60 each day. So when we have dogs, it's a little bit different at the stationary clinic. All right, let me go back to my slideshow here. Slides coming back up. Okay. So you saw that, yep, in the trap cats. There's going to be some that are freaking out occasionally. Most of them aren't. We try to even keep them in the, the covered area as much as we can. But you can sometimes put those traps up and down, like instead of flat like that, you can put them the top of the trap. I should just say, I guess, vertically placed. And sometimes that works. And if we have to, we use the fork separators. And then we have nets available. If they get loose, we don't need to use them very often, but sometimes you misjudge a cat and how sleepy they are. So we actually just use the nets from I go to Walmart, I get the bass fishing nets, and they're about 15 bucks. They're great, they last a long time, you can disinfect them. If a cat does get stuck or something, you can cut it. It's 15 bucks. It's not $150, and we have them everywhere. So it works out really well. We've done that for over 12 years. So timing is the thing that they get good at. They are going to be able to basically, whatever doctor they're working with. Right now, I just have one other doctor and me. We're pretty much, she's been doing this now 2 years, so she's pretty speedy. They get good at guessing how long it'll take us. Of course, if there's something like a pyometra or something pregnant spay, it might take me 5 minutes instead of 3. That's going to be a little bit different. If there's something that's major that I have to deal with, a wound or something, then I'll have to slow them down. But they get really good. We don't really have a set system like we were talking about in some of the earlier sessions. Some people do males first. Whatever we have come in, we just do them in that order. If I get a whole bunch of males in a row, I'll have the team prep them or clip them rather, and I'll prep them because I'm faster at the surgery than they are at the prep. We'll just kind of trade off that way. So that works pretty well. But again, you get the timing down when you get a feel for the rhythm with the team. So the prep, that's my former student, Kelly, right there. Let me get another video up here. This is going to show just her blood draws. And she's going to, we draw blood by ourselves. They're sleeping. It's pretty easy. You can also see while she's doing that, we don't draw blood for every cat. This is if people ask for the testing. We don't, this is just, sometimes we do owned cats. Sometimes we do cats that are going to be adopted out. We don't really do this much for TNR because of course that's not where our resources are best utilized, but some people want this. So we do that. We have the mask put on the cat. I'll show you in the next video here. I'll pull that up. Let me get that one. And that one is, oops, I'm sorry, I was muted apparently. So she's got the V trays. The V trays are, thank you for my team telling me to unmute. The V trays are great. They are available anywhere you buy, you know, your supplies, and you can tuck their little arms under. I learned that from a technician years ago. It makes it really simple. You don't need any boards or anything fancy. She is using the normal techniques we use for clipping and stuff, but you can see we have a little mask on the cat. We use medium-sized muzzles to hold them in place. And you can see in the background, we've got our ear tips, our ear clamps there. We have car malts available. We have all our other things. We have a pulse oximeter, which we lovingly call beepies. It's much more fun. Our paperwork, and you can see the blue clip on our paperwork. So she's getting ready to get this kitty prepped. She's also monitoring anesthesia. And you'll see her periodically touching the chest of the cat. She's feeling the heart. She's making sure the cat's breathing. We call it make sure beating and breathing are always happening. She is monitoring the cat. We don't need to put the pulse oximeter on for monitoring. That's there though if we need it. So then she's going to get the cat prepped. Oh, I think she's going to check the bladder first and empty the bladder. These are all the fun things you get to do. So prepping then, we get to use the same things that in private practice, but I do like these little handheld vacuums. They make life a lot easier. They're not very loud compared to other vacuums people use. Those are, you can get them on Black Friday for like 15 bucks. So stock up. And then we do our normal prep, which I have coming up here. So you don't need to see the rest. Just wanted to give you an idea of what's going on there. Okay, moving on back to the slides. Okay, so if they're not relaxed enough to put them in the V trays like that, we will let them relax a little bit more, of course. In the dogs, I don't tie the dogs down either. They just get placed on the V tray, and I tuck their little arms, their little paws under their collar sometimes just to keep them from rolling, or we use a couple V trays. It just makes things more efficient for us. And also, there is value in doing this rather than pulling the arms up. Pulling them up really stretched out, it actually makes it harder to get to the ovaries in the deep-chested dogs because you're kind of stretching everything up. So that's something to keep in mind too. This works for that reason as well. And that gives you something to carry them by. You can carry them very easily on those little V trays to their stations without having problems, and they're disinfectable, as are the masks, of course, in between patients. So these are the spay boards that some people use. I like how they put the tongue out like we do, so you can make sure it's nice and pink. That's monitoring. You can see the paws pads are pink. This to me, it's fine. I just worry about disinfection when you have ropes and stuff, they get wet. That's not an issue with the V trays. So we already talked about that. Chlorhexidine and isopropyl alcohol are the typical scrubs. There was actually a study that they looked at for these really tiny cats, the kittens that are maybe 1.5 pounds. Would it be better to give rinse that soap off with sterile water versus alcohol because you think, oh, alcohol is going to evaporate and make them colder? This is not the case. The study found it was equivalent. So no worries there. You can do either. And then, of course, we all know about the ear tipping here. The clamp, I have the prep person put the clamp on ahead of time, and the vet then knows that's an ear tip cat. We will double check the paperwork though before we cut it. So there's 2 places in which we double check the paperwork so we don't accidentally ear tip a cat that is a pet cat. The car mount being put on, and the doctor cutting is also good because I have seen cats come through where they've cut it in the prep area and then not done the surgery for whatever reason. They had to postpone it, and I don't want to do that. So we don't want that to be a marked cat ear tipped when they weren't done. So we try to avoid that. Anyway, okay, here's a little video, and I'm sure you guys have probably seen this, but if you haven't seen an ear tip done, it's very underwhelming, but I'm going to show you the video anyway as soon as I can find it. And I unmuted. Look at me go. All right, so this is just a quick neuter. This is our tools are all sterile, of course. I'm just going to cut there's testicles, not the close-up. I didn't give you the close-up surgery videos. Those come into my training sessions for the docs. Here's my little tie. I do a weird tie, but I have an ergonomic reason for it. I teach how to do 2 different ties in our classes. This is our neuter. Of course, it takes less than 20 seconds. Boom, we're done. Cat's neutered, nice and tight. And then the ear tip, I'm waiting for the camera to go around. That's my husband. Because, you know, you always make your family get involved. Come on, move around, get around. And here we go. Oh, that's the ear tip. Look at that. I've done studies on different types of ear tips. People use the wood burning tools and all these other things. And I just do that. And we use a styptic gel, which is, it's like $6 for a bottle that'll last you a year. So it's much cheaper than the silver nitrate sticks, that you use, and I wanted to save money, so this works just as well, if not better, and it's a lot cheaper. All right, so that's the neuter. And again, ear tipping is not always done. Okay, so I had, when I first started, and I told you the mobile was in my backyard, the autoclave was in my kitchen. Of course it was. So I was coming home and doing the packs before the next surgery day, because I had 3 volunteers and me when we started. So I came up with a more efficient way of using things, and my packs only have 9 tools in them, 9 instruments. I have them in these pouches instead of wrapping them. They are sterile just the same. It's just less waste. I don't have piles and piles and piles of wraps after 50 surgeries or more. And then I use as a sterile field. I use the back of the glove package. So that keeps the waste down, and it keeps it very much minimized. Gauze, I have 2 gauzes in there, and then there's gauze on the side if you need more. Because I used to have these like mountains of gauze, mountains of drapes, mountains of everything. And when you're in a small space in a mobile, it just became less efficient that way. And here's efficiency in surgery. So if you haven't seen a spay, I got you. Okay, so this is a spay. I don't use a blade handle. I just use the blade, just make a hole big enough for the spay hook to get in there. I do use the dowel clamps, or we call them owl clamps because they hurt when you get poked by them. They, fun things we come up with. They help me. Some vets don't use them, and that's fine. It depends on your doctor. Of course, I picked the pack with the biggest spay hook for this tiny kitten. You get it sometimes the first try, sometimes the second try, sometimes it takes you a while. That's okay. Ultimately, though, using this instrument and using it in a good fashion saves you from having to make a big hole. Smaller incisions are much more comfortable, of course, for the patients, more efficient. And I'm going to use my clamp there. We're going to do what's called a pedicle tie after I break this ligament. Here's the pedicle tie coming up. So we're tying a knot. Notice again, not cutting corners, not rushing. You'll notice I wear larger gloves because I get carpal tunnel, so that keeps me from getting too much compression. So I do wear gloves that are one size a little bigger than I need. But whatever you need to do ergonomically, I sit when I do surgery. I teach my students to sit when they do surgery. If you're in surgery for 7-8 hours, it makes your back so much happier. Very nice. So that's our second side. We're almost done with the spay at this point. So we got this tiny little uterus. We got a nice knot. I slowed down so I could show people the knots. And we tie this off with our suture. So we actually use the same suture for nearly everything because you can. It's a dissolvable suture called PDS. It's not the brand name. We get it for about $1.50 a piece. It's shorter and it's easier to work with. And I can usually even get a pregnant spay done with just 1 suture. That makes life a lot easier. The closing, you know, everything's more efficient. that's going to be it for the spay part. Now we're going to close. We got a small hole to close. Typically here you can get away with one, what's called a cruciate suture. And you're going to close this. I do a 3-layer closure. So again, we're not just trying to rush and cut corners by any means. This is basically like laparoscopic surgery without the laparoscope is like how I call it. So there we go. We're going to tie that off. And notice this is pretty bloodless surgery. I agree with when Dr. G was training people, she starts them on cat neuters. I actually go from cat neuters to cat spays instead of dog neuters, because once you get that tying technique down, I want them to do it on the pedicles. And then we do, the dogs. Unfortunately, in vet school, that's not how it works. You kind of get told you got to make them do these big giant dog spays right off the bat, and that's really not the best learning curve. So that's why I like to teach it in our way based on our experience and what makes the most sense to improve the students' not only competence, but their confidence, because that's some scary stuff. Doing surgeries is scary. And we want students to get comfortable and to be confident in what they're doing. And they'll become confident vets. There you go, burying the knot, and we're done. And then we tattoo it, which I think I cut off on this video. All right. And these are some of my students from Illinois. So this is after maybe the 9th or 10th day with me. They're making these tiny holes, these tiny incisions. And really, I showed this to my vets. I have techs, I have other support folks, veterinary assistants, volunteers that come through and train with us because we want to train the whole team. But I show them, I'm like, hey, try to make a hole from here to here, and I show them where, and I said, we can always extend it if we need to. Just give it a shot and see what you think. And I do that with the docs too, because until you realize how much you can do in a small hole, you don't think it's possible. And when I show the doctors that have been out for years doing, spays and neuters, showing them that the novices can do it really goes a long way. These students, these are just the average students that I was teaching. This is not my star student. We had them down to 10 minutes in some students, and after 10 days, 10-minute spays. That's the tiny little hole there. Cute little kitty. There we got tabbies, man. I'm really going for the tabbies in this presentation. What else? I have learned that, this partially was from the different clinics that I was involved with, but it also was because I was doing the packs myself. But we put the instruments, we have bins or buckets you can use with universal detergent, big gallon of it, maybe $5, lasts for a long time. Putting them in there once you're done with surgery keeps them from getting the blood and everything caked on them. This saves you so much work. And honestly, I have been using the same tools for 10, 12, 13 years now. And we just rinse them off. We just kind of scrub them if they need it. But most of the time, especially since they've been soaking all day, you don't need to do much at all. We're just, cleaning them a little bit, but really we're mostly just rinsing them off really good and then putting them in the packs and re-sterilizing them. We do the instrument milk if they feel like they're getting a little bit stiff, they're not working as well. But most of the time now, this is just like 10 plus years of experience. Those tools are doing just fine. So I think we can save some time there and find that happy medium where you're comfortable in scrubbing instruments. And then the cats go over to post-op. We put this V trays and the masks in disinfectant, which the bee's knees in shelter medicine is, of course, Rescue, which used to be called Excel. And it is an accelerated hydrogen peroxide product. You need 1-minute contact time for a lot of bacteria and such, only 5-minute contact time for the hardest to kill viruses, which are parvoviruses, feline and canine parvovirus, calicivirus, feline calicivirus, and so forth. So they will soak in there. We don't disinfect between cats those muzzles. They're not touching anything other than the outside of the mask unless they touch something and they got contaminated. If we have a cat that has diarrhea or looks like they might have ringworm or has some kind of anything that looks suspicious, we'll put a pee pad under them and then on top of the V tray and carry that around just to be safe. I did used to put pee pads under every cat, and then it became wasteful and it was not changing our outcomes at all. We have very, very good outcomes without having those pee pads in there. So we've adapted as we've learned. And here's our post-op station. This is where we give our meds, our vaccines. The styptic gel is on the ear clamp. And then we send those over to be disinfected with the rescue as well. We have about maybe 10 of these so they can sit plenty of time. We clean them off, disinfect them between. This, I have a little video just showing what she does for this as well. And I think that's my last video, I believe. Post-op coming up. Here we go. And that's Maisie doing giving the shots. So we keep the vaccines on ice. We have, I've tried fancier ways. There's nothing better than just the ice packs underneath a metal tray because the conduction it works much better that way. You're keeping it much colder that way. We have the sharps containers there. We have our syringes there. We have our bottle of rescue there, all of the things that we'll need. They can ask for microchips. They can ask for other things. We do have ear mite medication everybody gets. If they have ear mites for free, they get all of this included. That is the injectable ivermectin that you can get for cattle, and we make a 1 to 10 dilution of that. And then we put all of these things in these little Boston round bottles, so they're ready to go, and you can draw them up with syringes very quickly. Advantage 2 we use for fleas most of the time just because of the safety factor and the effectiveness of it over the years. So just, again, have it all ready to go, and then she puts the kitty back. And we're going to recover them in there. We're going to keep their little tongues out so we can see, and she doesn't put the tongue out right this video here, but I'll show you in subsequent ones what we do. Okay, last one I think. So this is our recovery. So we can see our little kitty with the tongue sticking out, nice. And we are returned to the carrier, so we don't have the clip on anymore. We've returned it to the circulation. This, we keep the doors open so that everybody knows who to watch most carefully. Once they start to rouse and they're starting to move around enough that they're gonna wanna get out of the carriers, then we close the doors. That doesn't mean we stop watching them. That means we just know who's going to be under more deep anesthesia at that point. But really with our protocol, they wake up pretty quickly. Within maybe 5 minutes, we're closing those doors. The person watching them is monitoring and watching all of the cats over there, checking to see, you know, if they have any needs. But if they're not waking up quickly enough, the big thing is take a temperature. We don't get hypothermia very often at all, but every so often there's that one cat that just tends to run a little bit cold, and that delays their recovery. So that's how we can tell if we need to do something differently. They maybe 1 in 1,000 cats or something like that, or even probably fewer than that, to be honest. And it's not just like spays, it's neuters. It's just that for whatever reason that anesthesia made that cat's temperature drop a little bit more than others. So when the cats crash, I will just tell you, when they do arrest, it is almost always in prep or as soon as they get to the surgery table, or maybe just shortly thereafter. It's almost never in recovery, which is nice to know. It doesn't mean we don't watch them. It's just nice to know that that's the case, because I know there are a bunch of groups that have volunteers doing this. They're watching the cats, they're recovering the cats, and they check them every so many minutes, and they're going around. And it's at least with our protocol, we know that the times when they need us to intervene with CPR almost always are going to be while they're still with the trained medical team. So in our case, it's with the trained medical team the whole time, because they don't go with our community partners until they're sternal, and then they go back out. So yeah, this just depends if we're mobile or if we're stationary. If we're stationary, they're going to be calling the folks once the cats get back into the carrier and the door's shut. They'll be calling them to start out, because they will be awake by the time. Some people drive an hour to get to us, so we make sure we tell them it'll be, half hour, 45 minutes maybe, so that they have time to get there. On the mobile, as soon as they are getting sternal, we send them back in with our community partners. The teams there will watch the cats the rest of the way, calling the people, and discharge them when they're awake completely. And sometimes they'll be like, hey, this cat's not awake very much. Can you do something? And then I get my hand in there and I ruffle them up a little bit, and they will pop right back up, because our lovely community partners want to be real nice and calm to them. And I'm like, no, just wake them up a little bit. They'll be okay. But we're happy to check them. If there's any question, we'll certainly take a look at them again. That's not too often that happens either. Something really simple one of my team members came up with is that we have this one group of awesome, wonderful cat ladies, and I say that with all the love, that would keep bringing the cats that we already did. Their system of organization, they got confused sometimes that they would bring us cats that we already had go through surgery. And all we had to do was flip the paper backwards, and that solved the problem. We just folded it inside out. There's a nice red sticker. There you go. You can see all the red stickers on those ones. The rabies sticker was red, so you can tell who was done. And then that told us who was done when we were looking from afar in the mobile. Also, then just folding them that way or flipping them that way helped the ladies know. And sometimes there's a guy too. Every so often we get a guy, but it seems to be the ladies that are there. So that's when they can go home. We do not hold animals. This is up to the caretakers. Most of the time, they're going to hold them overnight if they're in a trap, and they're going to release them the next day. If they are lactating, we let them know because they may want to let that female cat go that night if they're awake enough. And I will tell you, we work with some really good caretakers over the years, and they know what they're doing, and they watch these cats and they know they do well. And it's basically, it's a trade-off between, we don't want them to stay in a stressed, panic state for a long time. And if it's going to stress the cat out to keep them in a trap longer in a situation that's, not their home, then, we don't want that to happen. They have a house, they have, like our houses, but they have somewhere to go. They sleep there every night. They know where to go. They will go back there. They'll hunker down. They'll chill. They'll relax. So, we leave that up to the caretakers, but we do recommend, they don't keep them for very long in the traps, days and days and days, because that just leads to stress and more illness in that population. So we have a rolling discharge as the cats are getting done in the mobile. If they're sternal, we move them out slowly so that we can have the community partner start calling people rather than everybody show up at once. That seems to work the best. We used to do half and half, where we would get the first 24 cats done, take that whole group in, get the second half. But it's good for morale and when you're sitting there doing these surgeries, to see them like slowly trickling out and fewer cages and crates and carriers and traps in there. It makes it much better for the morale, I think, of the team. We're like, yeah, we're getting there. Look at that. And then we get down to 10 and we sing the final countdown from the 80s, nice, good rock song. And, it makes us feel good. So that's always fun. But yeah, this rolling discharge, same thing happens in the stationary clinic. We have our team member. So there's 3 people in the medical team, 1 person doing checkout usually, and then we have 1 person kind of floating. So that's our when we do 50 animals per our normal clinics at the stationary clinic. So these are some of our awesome cat ladies. Love these folks jumping over fences and doing what they got to do with their traps and bringing us pizza. We love them for that. So it goes both ways. So that is all I have right now, guys. I have time for some questions, I think. We do have a workshop that we offer that's worth 12 race credits for anybody who needs them. Even if you don't need them, feel free to come. Vets can get the approved credits. Technicians that need them can get those. I do them like once a month or every other month, since I'm teaching still full time as well. But there's a little thing there. If you want to watch more videos close up of how to do the ties, how to do the fancy things, the surgery, all that, I have other slides, videos there as well with that QR code that you can grab those if you want. And there's my email, and that's our web address. So thank you guys so much. I hope that was good and helpful for you. And I'm here for questions.
All right, so I'm going to dive into the questions here. Do you recommend recovering dogs? Oh, well, I think you might have addressed this, but I'll just double check it. Do you recommend recovering dogs and cats in lateral or sternal position?
Yes, we do lateral, and the dogs we recover on a blanket. There's just because they're just too big. I done dogs in the mobile setting, and I did 43 one day in at fire hall, and that was not fun. I took 5 support members, and then we had the community, and they didn't have it run well. So I'd much rather do the stationary. We just have a nice big blanket, and then we have a technician watching them there. The cats we put lateral as well, butt end in first to the cages, so we can see their faces. We can monitor their tongue color. We can watch them breathing. That's typically what we'll do.
Where were you trained to do the flank spay, and when do you do a flank spay?
Okay, I've never done a flank spay because I don't think I could get faster, and it's not going to be of any benefit for me, but there are people that love it, and I'm totally for it. That's great. It's really a similar setup. You have them in lateral position for that surgery, of course, and prep it differently. You're going to cut, it's going to be in the muscles, essentially like your abdominal muscles on the side. And then it's nice because you can make the incision. You can actually use a hemostat and separate the fibers, the muscle fibers, or I don't have scissors in my packs. I try to minimize it, as I said, but you can do that. There's very little bleeding. I think the time I would use it, if I were in a situation where I had big dogs and not good suture, if it was a country or a situation where I didn't have the best supplies and I didn't trust that my suture would hold my closure, that's when I'd be worried about that. But again, it's a time-tested technique. It works well. It's just in my hands, I don't think it would make me any more efficient.
Do you ever use, or do you use gabapentin at all in your clinic?
Yeah, that's a good question. I feel that, and maybe this is just my lack of use of it. I feel that it's more for nerve pain and other things, and I pulled it out for that. We use a lot of meloxicam, and I do. Every cat gets the meloxicam. It's 1/3 of the dose that's on the label, and and I have all these protocols as well. But the 0.1 milligram per kilogram, it turns into 0.1 cc per 10-pound cat, and it's really easy to get that administered. We try to keep it as simple a protocol as possible because then you won't have errors occur nearly as often. I mean, we're not perfect, right? I've had 3 people overdose meloxicam. They were students. Over the years, tens of thousands of cats. Still not, makes my heart. Put them on fluids, they did fine, but that's something that we'd worry about. I just feel that having an anti-inflammatory on top of the pain meds works really well. And from my own personal experience with pain medications, opioids didn't do a whole lot for my husband or I. And ibuprofen does a really great job. So it's just my bias. It's partially my bias, and it lasts 24 hours. I like that, and they do great. They're running around like nothing happened. So.
Just to confirm, ear tipping and tattooing happens on the same cat.
Yes. Oh yeah, tattoo. Everybody gets a tattoo. I don't care who you are. You can be a show cat. You're not coming to my clinic probably, but they try to sneak them in. I get people sneaking bangles in, everything else. And guys, everybody gets a tattoo. All the girls get a tattoo. The boys, we don't. Some people do, but you can tell if there's barbs on the penis. So if there's a male cat that is bilateral cryptorchid, meaning neither testicle dropped, it's very uncommon. I've seen 10 ever, but you will find that that cat has barbs on the penis because testosterone's still being produced. So there's a way to determine that without tattooing them, and that would just be another thing we'd have to do. Some people do that. That's totally fine. It's up to them. But then only the cats that are requested to be ear tip, or if we're doing TNR projects, which we do, we'll go and do like 90 cats in a weekend at a trailer park or something like that. We will ear tip those.
Mm-hmm. Mm-hmm. Gotcha. All right. Somebody reported in they recently had a flank spay done, and it was awesome, but it's very difficult to find vets to do it.
Yeah, there's no value, I mean, one over the other in the scientific literature. So it just depends on the surgeon. I mean, really, it's the surgeon and their outcomes and what they like to do. Preference is really what we go on.
So I'm going to make an assumption, but I'll ask the question. You spay neuter feral cats all year long. You don't stop in the winter.
Oh, yes. That's a great question. No, we can finally get ahead of the game. My God, yes. Yeah, we know the outcomes are good because, like I said, these people are watching these cats. They go back out. They are paying attention. The cats do well. The one I just told you about, we did for real. That one clinic was 96 cats, I think we did in a weekend. And I think it was February. And they all were great. Everybody was watching them. This was one of the places that you just wish would call you. Like everybody at this trailer park was so involved and helpful and thankful that we were there. And hey, I got one trapped in my outdoor. You know, they were helping us. And yeah, they watched them. The cats did great. They don't get super cold. We just shave less. I mean, we try to be wary of that. We don't shave as much anyway as private practice vets because we're making smaller holes. So we do. That's a great question though.
Mm-hmm, mm-hmm. And yeah, because I know that there are parts of the country where they're like, oh, yep, nope, it's winter time, we're going to stop. And from my perspective, it's like, no, it is the best time to do spays and neuters.
And that's accepted. Yeah, it's accepted across in shelter medicine. We all agree on that. So that's a more of a bias, and I understand. I mean, once you see something happen, it's hard not to be affected by it, or if you perceive something to be a problem without having people telling you it's not. Like, I didn't know that you could put tattoo ink right in the incision until another shelter vet told me that. So I was doing it how I was taught, and it was beside it because I had to learn all this stuff way after vet school. And then I started putting in the incision. And I'm like, absolutely right. I don't have to make another cut on this cat. It's after you close all your layers right before the glue, you just put a little bit there. Never had a problem. Tens of thousands of cats. So, I mean, the numbers are the proof for us as well as what the science tells us.
Mm-hmm. Yeah, for sure. And then also, I mean, if you are an organization that adamantly isn't going to do TNR cats, then do some owned cats at least during the winter time, right?
Absolutely.
I mean,
Absolutely.
I don't neuter the, I mean, whoever's living with an unneutered male cat in the middle of winter, I don't know, but if they are, let's get them neutered, you know, make the most of the opportunity. Don't just close the program down. So that's
absolutely. No, absolutely. And I honestly, if we had our way, this is our budget is basically our service revenue. So if I had my way, we'd be doing all targeted TNR. I know, but as of right now, we do projects like that, and we do them for free or very, very reduced fees. We do a lot of stuff for free. The medical stuff's all free. So, you know, we have to have a way to bring in the money to support that. And that's the only reason. I think that there are more vets that do this. And I think that's why we're trying to work with the training and just having people be aware of it. If every vet just does 5 more surgeries a day, if we can get them empowered to do that, 5 cats on their surgery schedule a day, that would make a tremendous impact. And that's what we're trying to do.
Yeah, for sure, definitely. And, you know, to get more efficient and speedier. And, you know, some people will say to me, well, you know, if they're just using it in private practice, we don't want to train them on the high volume, high quality spay neuter techniques in private practice. And honestly, I think everybody should just use these techniques because it's going to help at the end of the day, because maybe it makes our days shorter. So maybe it helps our mental health and our well-being. And then maybe then you'll volunteer too on a Sunday clinic. It gives you more capacity, or it gives you enough time to recover so that you're staying in the business longer, right? So,
yeah, absolutely. And we actually did a survey, and we presented our findings in a poster presentation at Best Friends. We found that the private practice vets that came to the training were more likely to hold a community cat clinic, or they felt more comfortable. They could do faster spays. They would do more to help the community. So it's just our little bit of data, but I mean, it's certainly, that's what we were hoping for.
Right. And it's a baby step, but it's definitely a baby step in the right direction, for sure. You know, and so if we get to the standard of feline fixed by 5 in private practice as well as in the nonprofit space, and we also get into using the high volume, high quality spay neuter techniques as general best practices, I can see a lot changing in our operations across the board.
Absolutely. And more than half the battle is for people just to know this is a thing. I mean, we know it, we live it, we breathe it, but the average veterinarian didn't get exposed to this, and that's why we're reaching out to the vets and as well as the students.
Yep. How do you recommend, last question, so how do you recommend that we do this, other than we have it through the students? You think we should all go and table at conferences and talk about, have the high volume, high quality spay neuter table, or, you know, what should we do?
Yeah, I really do. That's what we did. So we were very lucky that the American Feline Practitioner, the conference was in Pittsburgh, and I'm like, oh my gosh, we're going. So I got a table. I had videos. I had 4 TVs. I'm crazy, but I had little iPads there, and I had the stuffed animals with the balloons for the practice, the pedicle ties, and we had a lot of people come over, and it was very educational. They saw the videos. They saw it was good. quality and, you know, it's not cutting corners and that type of thing. And I think we do. We need to be out there, and I call it proselytizing. I did present 6 hours at the state VMA conference in August, and it was great. I mean, you're going to have those people that this can't be quality still, and that's why we're here to show them that, no, look, I have data, I have a lot of experience, and I can help you to understand it.
Yeah. Well, excellent. Fantastic. I want to thank you so much for spending your afternoon with us. Really, really appreciate it. Everybody, go scan those QR codes. Definitely, it's in your slides. Use those QR codes. Share it with your veterinarians. Share it with all your staff. Yep. Just spread the gospel. Woohoo! Right? And all right.
Amen.
Anyway, amen. Right. So.